Today I'm going to do a head-to-toe assessment of my patient. I'm going to start with the nose, mouth, and throat. First thing I'm going to do is just assess just by looking. So inspect his nose for symmetry, nasal flaring. I don't notice any nasal flaring and his nose is nice and symmetrical. The next thing I'm going to do is check for patency. So I'm going to gently press on a nair and have him breathe in, and then do the same with the other side to just make sure it's nice and patent. Then I'm going to grab my flashlight and I'm going to gently push on the tip of his nose to look inside. And what I'm looking for is that his septum is nice and even, that I don't see anything obstructing his nasal passages, and which I don't, and that his nasal mucosa is nice and pink, which it is. Okay. Now I'm going to inspect the patient's sinuses. I'm going to start with the frontal sinuses, and I'm just going to push gently, and I'm going to ask him if he feels any pain or pressure when I do that. Any pain or pressure when I push there? Then I'm going to move to his maxillary sinuses, and I'm going to push gently. Any pain or pressure?
No.
Okay. After that, I'm going to move to the mouth. So first thing I'm going to do is just inspect, and I'm going to look on the outside of the mouth at his lips just to make sure I don't notice any lesions, any bleeding, cracking, anything that of concern. His lips look nice and intact, pink and moist. We're going to move into the mouth next. I'm going to grab my flashlight again. And can you open your mouth? I'm going to check first, look at all of his teeth. And I don't see any that are missing or any that look like they need any attention. I'm going to look at his buccal mucosa in the mouth, and it looks like it's nice and pink. I don't see any lesions or soreness. I'm also going to look at his gums. I'm going to have gloves on, of course. And I'm going to look in here and just check all his gums. And it all looks intact, and I don't see any problems with that. The next thing I'm going to do is grab my tongue depressor, and I'm going to push down and have the patient say, ah.
Ah.
And what I'm looking for there is I'm looking to inspect his tonsils, which he has had his removed, but I'm also looking to when he says, ah, when I push down, I'm looking at cranial nerve 9, and that is to make sure his uvula and his soft palate rise when he says, ah. I'm also, while I'm here, I'm going to check for cranial nerve 12, which is having you please stick your tongue out and move it from side to side. Okay, very good. Now we're going to move on to the neck. The first thing we're going to do is just inspect. I'm inspecting his neck. I don't see any areas of breakdown, any noticeable lesions, bumps, lumps. Looks nice, correct color for his ethnicity. I'm going to palpate, and I don't feel any lumps or bumps. We're going to check for range of motion of your neck. So the first thing I'm going to ask you to do is please take your chin to your chest, okay, and back up and look to the ceiling. Very good. Now if you could just come back to center. If you could look to your right and look to your left, and then just can you move your neck like all the way around in a circle. Very good. And then while we're here, we're going to check for cranial nerve 11, and that is where I'm going to ask you to take your left ear and place it to your shoulder and back to center, and then your right ear into your shoulder. Okay, very good. Next, we're going to palpate the lymph nodes. So I'm going to start with the why am I drawing a blank? I'm sorry, subauricular, which is right here in front of the ear. And I'm just looking to make sure that they feel less than a centimeter and you're not having any tenderness or pain. And then I'm gonna move to the postauricular. Okay, then I'm gonna move to the occipital. No tenderness, pain. Okay, the submental. You can keep your head forward. And they don't feel enlarged, they're not over a centimeter. And then the submandibular under the jawline. And then I'm going to move to the post-cervical, right here in the neck. Checking to feel if they're enlarged or sore. And then deep cervical. And then posterior cervical, excuse me. Okay, then we're gonna move to the clavicle, feel for the clavicle, and we're gonna, right, oh, because you're holding that up. Over here, the supraclavicular lymph nodes. And those do not feel enlarged and you don't have any tenderness. Okay, we're going to move to the thyroid and I'm going to inspect and palpate. I don't see that his thyroid is bulging or anything. I'm going to come behind. I'm going to find where his thyroid is, palpate and feel. And then I'm going to have him, as I have my fingers on both sides of it, I'm going to have him swallow. And then I'm going to have him look to the right and swallow, and to the left and swallow. And what I'm looking for there is to make sure that it rises and lowers symmetrically, which his does, and I didn't feel any lesions or nodules or any enlargement of that thyroid.